Good day, everyone. My name is Onuoha Chisom, a 200 level healthcare management nursing student of the Noble JPTS Institute of Management, Science and Technology in collaboration with South American University, USA, Global Wealth University, Togo, Pan American College, California. I am currently studying in Makurdi, Benue State. And I'll be presenting a brief seminar paper on the topic the presence of hepatitis B envelope antibody in a patient who have been previously screened for the surface antigen. But before we go on, I would like us to understand that hepatitis is the inflammation of the liver. The liver is a vital organ of the body that processes nutrients, filters blood, and fights against infection. And when the liver is inflamed, its function is being limited and is affected as well. Hepatitis is commonly caused by a viral infection, and other possible causes of hepatitis include heavy intake of alcohol, some medications, and certain medical conditions. We have 5 types of hepatitis. We have the hepatitis A, B, C, D, and E. And I want us to also understand that hepatitis, different virus is responsible for each type of virally transmitted hepatitis. Today, we'll be concentrating more on the hepatitis B. The hepatitis B is caused by a virus, and it is an infection of the liver. It is in some people mild and lasts for a short time. And now there is a vaccine that protects against hepatitis B. Some symptoms of hepatitis B include jaundice. This is when the skin and the white of the eye turns yellow, fever, fatigue that persists for weeks or months, belly pain, joint pain, the pee turns brown, and nausea and vomiting. Now, hepatitis is transmittable, and the most common way hepatitis is being transmitted is by having unprotected sex with someone who is infected, sharing needle or syringe that is contaminated with infected blood, and from mother to child. In the case of the mother to child, I want us to understand that hepatitis is not hereditary. Hepatitis is passed from a pregnant woman to her newborn during childbirth, and there's a vaccine that protects the newborn from being infected. Now, talking about the hepatitis B surface antigen, I want us to understand that the surface antigen is a protein found on the surface of the hepatitis B virus that is present in the blood of someone who is infected. And when a patient is tested positive or reactive to this, it implies that the patient is infected with hepatitis B virus and can spread the hepatitis B virus to other persons through blood and any fluid from their body. And when subsequently this same patient goes for another test, which is the hepatitis B envelope antibody, and its result is positive and reactive, it implies and indicates that there is no viral replication, or there's a low level of viral replication in the patient. That's to say, the replication of this virus in the liver is limited or is stopped, and hepatitis B can be treated with antivirus or hepatitis B immunoglobulin drug. Yes, in conclusion, I want us to understand that hepatitis B is a serious global problem, and over 2 billion persons in the world is infected, and it is estimated that in Nigeria 23 million persons are infected with this. And the only way we can limit and stop the spread of this hepatitis B infection is by abstaining from premarital sex. And if you can't abstain, the use of protection is highly recommended. And then making use of sharp objects, you have to sterilize it, especially when you're not the first person to make use of that object, such as blades, needles, clippers in the salon. When you go to the salon, try to make sure that it gets sterilized, or you get your own personally for yourself. And with these preventive measures, I know we can fight the spread of hepatitis B in our nation. Thank you.